Hey guys and gals, it's Dr. Marcy, and I'm going to take a few minutes to explain part of this comment that this woman says about, they never told me this, but all my low blood work levels indicate malnutrition. And part of the reason I want to talk about this is because this woman is not the only one. And to me, this is gross negligence and malpractice, but it also happens to be a gold standard in current Western medicine. So this person had a gastric sleeve done, and now she is not digesting food. She can't eat any fats, but your body needs fats for the health of your nerves, the health of your brain, so that you don't develop Alzheimer's or dementia, Parkinson's disease, and so that you can appropriately produce every single hormone in your body. But she can no longer digest them because her body can't break them down. And she's been told she needs to take ox bile, but she's still testing like she's malnourished, even though she's eating every day. This is not uncommon at all with anyone who has any kind of gastric bypass surgery. If you are someone who has elected to have a gastric bypass surgery, you are going to need to find somebody who knows nutrition inside and out and understands the absolute 100% positive need for liquid vitamins. The unfortunate thing these clients are never told is that eventually, to sustain nutrition, they will also require a feeding tube, because they will get to a point where their small intestine cannot handle any food touching it, because they've created leaky gut, because the things that are going into their mouth are not going through proper digestion. Digestion should start first with your nose. When you smell something and it causes you to salivate, that is the start of digestion. It helps your body produce appropriate enzymes to begin the process of breaking down simple carbohydrates in the mouth. The second part of digestion is mastication. Mastication is chewing the food. Everybody should be chewing their food to the consistency close to salsa. But people who've had a gastric bypass especially need to do this. They need to eat slower because they need to absorb as much as possible in the mouth. The third part of digestion happens in the stomach. Hydrochloric acid is released as the salivary enzymes get to a certain level and as you swallow to start breaking down food. The food that should be the consistency of salsa. The stomach works to mix the hydrochloric acid in with those food particles so it can break down proteins specifically and complex carbohydrates. It's then moved into the upper part of the small intestine, and more gastric enzymes are released from the pancreas. That is the fourth part of digestion. After pancreatic enzymes are released, you will get release of bile that was produced in the liver, cleansed by the liver, recycled by the liver, from the gallbladder. But with most of these patients, they are also missing a gallbladder. The really bad part about all of this is the very first part of digestion can still occur, but because you're lacking some other enzymes down the road, the first part that starts with salivary enzymes being produced because you can smell your food actually decreases over time because you can't absorb vitamins and minerals. Therefore, salivary enzymes are not produced. The second part of digestion you still have very much control over. In fact, it's the only thing left that you have control over. So please chew your food to the consistency of salsa. Part 3 and Part 4 have been bypassed. Part 4 and Part 5 have been bypassed. And so they tell you to start taking ox bile to break down your food. Well, guess what? Ox bile doesn't break down proteins the same way hydrochloric acid in the stomach does. These people typically will show up first with an essential fatty acid deficiency, and it will look like non-diabetic peripheral neuropathy. It will look like forgetfulness. And then they start showing up with a protein deficiency, and they get ketosis of the breath, which means that their kidneys are starting to struggle too. When the kidneys start to struggle, the heart starts to struggle. When you can't absorb essential fatty acids, you can't have proper nerve health or brain health. When you stop being able to digest protein and absorb protein, you can't build muscle. You also can't have appropriate adrenal function because you can't absorb the vitamins and minerals from anything that you're eating. If you are someone who is considering having gastric bypass surgery, having a gastric sleeve done, trying one of the GLP-1 inhibitors, please reach out to someone like me who does a program like I do based on your genetics to help you lose weight first. Because you may think you've tried everything, but I've helped women in menopause. I have helped women done with menopause. I have helped women just after having a baby. I have helped women during pregnancy. I have helped people with eating disorders correct the eating disorder. I've helped diabetics get off their diabetes medication. I've helped people on blood pressure meds for 30 plus years get off of those meds. I've helped people stop taking their cholesterol meds. I've done it when everyone else has said you have no other option. The truth is you do have an option. And it's not to help a surgeon buy another house in some mountain ski resort. It's not to help some doctor go on a European vacation. Your option is to be treated like the individual you are, looking at your specific genetics, supporting them appropriately, and figuring out exactly what you need to do to stay healthy for as long as possible, to reverse your poor metabolism, because it is possible. Because the end result of something like a gastric bypass usually results in gastroparesis and the need for a feeding tube to stay healthy.